Guyana is experiencing an upsurge in positive dengue cases. During an interview with the newsroom on Thursday, infectious disease specialist Dr. Shamiza Shah explained the dengue virus has four types. Guyana is conducting tests to determine the type of virus persons are infected with, and Dr. Shah said this is important because the virus is life-threatening.
When there's an increased number of cases, it's important to know which serotype is causing this. And it's more for a reporting and an epidemiological perspective and surveillance to know which serotype is prevalent in your country, and to correlate with the region, because there are a number of cases that are increased in South America, in Latin America, and in the Caribbean as well. So it's very important to do serotyping, just to know if this is serotype 1, 2, 3, 4. And to also know the clinical signs that can come with some. Some are a little more virulent, meaning a little more, can cause a little bit more severe cases than others. So it would be good to know the serotype.
While the doctor could not confirm whether previous infection types are known, the National Public Health Laboratory has started testing to confirm what dengue type is circulating now.
So serotyping is very dependent on the lab's capacity, and our lab has improved their capacity tremendously. So the National Reference Lab is now able to do that serotyping. So I don't think it was done in the past. I'm not 100% sure, but I really don't think it was done. But right now we offer that specialized testing method. They've recently started serotyping, so it will take a while to get the cases. And the positive cases now have to be sent to the reference lab so that they can do that specific test.
The four dengue viruses are similar, but even within a single serotype, there is some genetic variation. Despite these variations, infection with each of the dengue serotypes results in the same disease and range of clinical symptoms. However, she noted that studies have shown that reinfection of the disease is highly possible, and a person can be reinfected with each type at some point.
So if you get infected with one serotype, you usually have immunity for a very long time and you don't get reinfected with that same serotype. But like I mentioned, there are four serotypes, so you can get dengue 4 times with each serotype. And that's why it's important to know which serotype we have. Again, coming back to our testing for that. But persons can get reinfected with a different serotype. Usually your first infection it can be not so bad, so you could just have the febrile phase. The reinfection can be worse. So it's noted, and there are studies that show persons that have a reinfection with dengue, a different serotype, usually have worsened disease.
By knowing which dengue type a person is infected with, doctors can determine why symptoms are more severe than other persons, and the entire LAC region can use this data to know what type or types are circulating. This information is also useful for treatment and mitigation purposes. Reporting for the newsroom, Lizina Yearwood.